Dr. Brian Heaberlin here with Lexington ENT and Allergy. So you've been referred to an ENT doctor, or as we call them, otolaryngologist. Well, what is an otolaryngologist? Why would someone go into that specialty? And what can you expect from that visit? Well, an otolaryngologist is a fancy term for just ears, nose, and throat. And so we're specialists that take care of various ear problems. We manage many of these problems both medically, but we also have the ability to do surgical procedures on things as well. And so ENT doctors are surgeons. And so we also manage nose problems and throat problems. So what are those problems? Well, we work on little young children with ear infections that need ear tubes, older adults that might need holes in the eardrum repaired, or even problems with dizziness and balance disorders that can be related to inner ear conditions. All kinds of nasal problems such as sinus problem, deviated septum, people that are getting allergies and need allergy shots. So we manage both medications, and we sometimes have to do surgery to fix these things when medications aren't effective. And then all kinds of throat related problems, from voice disturbances to swallowing complaints to head and neck cancers that can affect the tonsils or the base of the tongue, or voice box cancers, neck masses, salivary gland problems. So there's a whole lot of things that fall into ENT. And why is one doctor taking care of all those things? Because many of these things are interrelated in a lot of ways. And so the ears are connected to the back of the nose, so nasal issues and sinus problems can exacerbate ear problems, and likewise all of the things made from our nose, nasal mucus and drainage, causes sore throat, and affect tonsils, and cause just a lot of things are interrelated in our specialty. And so long time ago, eyes were included in our specialty, but now ophthalmologists are a separate thing, so ENT doctors don't take care of eye disorders really at this point. So that's the overview of what an ENT is. Why would someone want to go into that specialty? So I'll speak for myself, but I think this echoes true with most otolaryngologists. As we're going through medical school, we are presented with different options. We rotate through different services, and we find what we like. And so as an ENT doctor, I chose this specialty because I like taking care of all types of people. So I may take care of a 5-day-old who needs their tongue tie clipped, or I may take care of a 95-year-old with severe hearing loss. And so I can take care of both women and children, and I can take care of men and women. So you really have a lot of variety on the patients that you can take care of. So that's a big draw for me for this specialty. And then there's just a ton of variety. It may sound like we're working on one small little area, but we manage medically, we manage surgically, we do office-based procedures for things, or it may be simple as me giving you some advice about what to do on your own at home to avoid certain problems and improve you in ways that we can. So we always like to be as minimally invasive as possible, but we have the ability to be more maximally invasive if that's what's required. So how do you get to become an ear, nose, and throat doctor if that's something that you're interested in? Well, obviously we go through high school, then you go to college, and various college majors can be used to get into medical school. My degree is in chemical engineering and chemistry, so I have a degree in that, and then went to medical school, and after medical school, then you get matched into a specialty, and so you get to choose what you're interested in, and then you go through a process to try to find a program that can train you in that. And so medical school is 4 years, and otolaryngology residency is 5 years, and then you have the option to do fellowships if you want to become more subspecialized and only do one small piece of otolaryngology, but in a more specialized way. I am a general otolaryngologist, so I kind of manage all things, but there are times I refer people to other otolaryngologists that do more specific things that I don't do as a general otolaryngologist. And so there are several fellowship programs that people can elect to go to after their general otolaryngology. There are head and neck cancer surgery. There is rhinology, which deals more with very severe sinus conditions that aren't managed by someone like myself. And then there are fellowships in laryngology that specializes in voice disorder. There is specific pediatric otolaryngology that subspecializes in very complex pediatric patients who may need airway reconstructions or other things. All general otolaryngologists do things like tubes and tonsils all the time. So we take care of kids in all of those areas, but there are some subspecialized pediatric otolaryngologists that deal with very complex cases. There's facial plastic surgery, where you can do both cosmetic and reconstructive plastic surgery, and then there is otology or neurootology that deals with more complex ear disorders and balance disorders. So someone that might need very rare ear surgeries like a cochlear implant or things are often managed by someone like a neurotologist. So that's a broad view of ear, nose, and throat doctors and what they do. So what can you expect from an ear, nose, and throat appointment? Well, when you're seeing someone, they're going to be obviously examining you and talking to you and just getting some history. So many times it's just an appointment not that much different from what your primary care doctor might do, although we can sometimes do small procedures like put a scope in someone's nose to look at their sinuses or to look at their throat. And so those things sound like a big deal and they sound scary, but they're extremely well tolerated by patients. So we're not going to do anything with the intention of hurting someone. And the small procedures that we do in the office are all very, very tolerable. If it's something that's not something someone can manage in the office, then they may need to be put to sleep for different things, but that's not that common. We examine people with microscopes and clean out their ears sometimes and get a better look at their eardrums and can just manage things that your primary care doctor doesn't have at their disposal. Hope that helps give you some idea of what ear, nose, and throat doctors do and what to expect from an appointment. But we're all pretty nice, easygoing people. We're happy to take care of you in whatever ways we can to make you better. Thank you.